Canada is falling behind other G7 countries when it comes to providing support for people with dementia. A new report from the Brainwell Institute found Canada is lagging when it comes to prevention, diagnosis, and end-of-life care. And joining me now to discuss those findings further is Dr. Saskia Sivananthan, founder and CEO of the Brainwell Institute. Good to speak with you.
Thank you for having me.
First, maybe just give us an idea of how far behind Canada is falling compared to other G7 countries when it comes to dementia support.
Right. So we compared Canada to other similar countries because Canada is a federated model, which means that we have different healthcare systems and our provinces and territories have a lot of autonomy around how health is implemented. And really, Canada ranks 7th out of 12 compared to similar countries. And the areas where we particularly looked at was how are we implementing care for dementia? Is there a pathway through the health system where people know where to go next, how to get a diagnosis, and are being better supported? And unfortunately, this is the area that Canada is not doing very well on because we don't have clear measures of what is success.
You know, speaking of diagnosis, we know it can take roughly 2 years to get a dementia diagnosis. Why is it taking so long to get diagnosed?
There is a lot of stigma around this disease. Dementia, and Alzheimer's is the most common form of dementia, is often seen as a mental health condition. And to be really frank about it, people don't feel like there's a lot of hope when it comes to the disease. And because of that, they're more afraid about getting the diagnosis because they really don't see what the next steps would be. I'm actually at AAIC, which is one of the largest conferences related to Alzheimer's and dementia. And what we're hearing about are new ways of diagnosing the disease, better ways of treating it, rehabilitative approaches. But if we don't have a pathway through the system and coordination around that, then there's really no way for people to get access to it. And that's part of the problem. The other is that family doctors, who are the primary way in which people get a diagnosis of dementia, don't feel well trained. Only 41% of family doctors said that they feel comfortable diagnosing and managing dementia. And it's not a very high number when, again, you compare to other G7 countries, which are closer to 75, 80%.
All right, diagnosis just, one step in treatment. Once you do get that diagnosis, how long does it take to get the right treatment?
It's a fraught road. And that's mainly because, again, unlike other diseases like cancer and stroke, where after you get the diagnosis, we have benchmarks around how quickly you can get to a therapy, how quickly you get access to additional supports. We just don't do that for dementia. So if you get diagnosed, and the average is 2 years, but sometimes it can take up to 5 years, particularly for some types of dementias like young onset dementia, you're left to your own devices to basically figure out how to navigate the system. So there really isn't any clarity. We don't have any data around how long it takes for people to access better therapies. We also don't even have data around rehabilitation as a form of support, home care, all of these very crucial things that are needed for dementia care.
All right, how do we change course then? What are your recommendations to get our system on track?
Well, part of what the report really does is learns from what we've done in other fields. So Canada is actually a leader when it comes to cancer and stroke care, which 20 years ago was in a similar state to dementia. And after we had real provincial engagement and federal engagement, where there was leadership and coordination, we set clear benchmarks and we created coordinating agencies or networks that were focused on helping people navigate through the health system. We really think that when you think about dementia, this is not just a health issue, it's an economic issue. It's costing us $4.1 billion a year, and it's a productivity issue because we're talking about caregivers, particularly women who are stepping away from the workforce, providing informal care, whereas if we put that coordination and pathways in place, they'd be able to continue to engage economically.
Dr. Sivananthan, I want to thank you for your insight and time tonight. It was great speaking with you.
It was such a pleasure. Thank you so much for having me.